Getting ready for your colonoscopy. This video will guide you through the preparation for a colonoscopy procedure at the University of Vermont Medical Center. A colonoscopy is a procedure that is used to screen for colon cancer or other conditions of the large intestine. Because there are many things you have to do starting 7 days before the procedure, please watch all the way to the end of this video. If you are unable to do all that is required, you may be turned away from your appointment. If you need assistance, please call 802-847-8899 for an interpreter and tell the receptionist the language that you need. Ask them to connect you to 802-847-8865 extension 2. You will then be connected with the office and someone who can help you. 7 days before your colonoscopy, you will need to call your pharmacy to make sure there is a prescription for your preparation. You will need to get this prescription at least 7 days before your scheduled procedure. Please contact the office if you are having difficulty with your prescription. You will also need to arrange a ride home from the hospital. You must have a responsible adult drive you home or be responsible for you on public transportation. This person does not have to stay at the hospital while you're having your procedure, but must be within 15 minutes of the hospital. Your estimated stay is 2 hours from registration to discharge. You will need 4 Ducalax laxative or generic bisocodyl laxative tablets, 1 238-gram bottle of Miralax or generic polyethylene glycol, 64 ounces of Gatorade that are not red or purple. Stop eating foods with seeds and nuts for the 7 days before your procedure. This includes foods that have seeds or nuts on them: bagels, cucumbers, tomatoes, bread, or popcorn. If you take blood-thinning medication, diabetes medication, or medication for weight loss, please call your primary care provider to ask how you should take these medications before and after your colonoscopy. Stop taking iron and herbal supplements 7 days before your procedure. 1 day before your colonoscopy, there are guidelines that must be followed to complete your preparation. You cannot eat food of any kind today, except for popsicles that are not red or purple. You may have any of these liquids: water, apple juice, white grape juice, ginger ale, sports drinks like Powerade or Gatorade that are not red or purple, Crystal Light, black coffee, black tea, and Kool-Aid that is not red or purple. You may not have any liquid that is red or purple: Jell-O, broth, juices with pulp, ice cream, alcohol, gum, any food or anything that is not one of the liquids we just mentioned. Please take your approved medications today as prescribed by your doctor. Follow your instructions for diabetes medication, weight loss medication, and blood thinners. No herbal medications or iron tablets. Miralax preparation instructions. At 5 p.m., take 4 Ducalax or generic bisocodyl pills with a full glass of water. At 6 p.m., mix 1 238-gram bottle of Miralax or generic polyethylene glycol and 64 ounces of Gatorade that is not red or purple into a big container. Drink 1 8-ounce glass of the mixture every 15 minutes until you finish half of the container. Refrigerate the rest of the mixture in the container. You must finish half of it, even if you have diarrhea. If you become nauseous, stop for 30 minutes and then start drinking again until you are finished with the first half of the preparation. It may also help to drink through a straw. You may drink as much of the acceptable liquids along with the Miralax solution as you like, including water. The more fluids you drink, the cleaner your colon will be. Use Desitin on your bottom if it is sore. On the day of your colonoscopy, 5 hours before your procedure, drink 8 ounces of the remaining mixture every 15 minutes until it is finished. You must finish all the preparation within 2 hours. You are not permitted to drink anything within the 3 hours before your procedure time. Drinking anything within the 3 hours may delay or cancel your procedure. Your stool output should be clear yellow, like urine. If you are concerned that your stool is not clear in color, please contact the office at 802-847-8865, extension 2. 3 hours before your procedure, take your approved morning medications with small sips of water. Then completely stop eating and drinking, as you cannot have anything by mouth 3 hours prior to the procedure. Before your procedure, remove all jewelry. Leave your valuables at home or plan on giving them to someone during the procedure. You will not be able to drive, work, operate equipment, or anything else that requires judgment or reflexes. Park in the garage if your driver is staying with you. The first hour is free. If your driver is not staying and needs to contact us, our number is 802-847-9255. Please arrive at the reception desk on the 3rd floor 1 hour before your scheduled colonoscopy. If you need an interpreter, please arrive 90 minutes before your scheduled appointment.